Hello everyone. I'm Dr. Taninee. I'm pediatric endocrinologist from Faculty of Medicine, Chulalongkorn University, Bangkok, Thailand, which is affiliated with King Chulalongkorn Memorial Hospital, Thai Red Cross Society. I would like to thank Action for Diabetes A4D for opportunities for sharing the story and the outcome of the newly established transition clinic for emerging adults with type 1 diabetes at our hospital.
Over the past 5 years, with support from National Health Security Office and Diabetes Association of Thailand, we start a type 1 diabetes registry in Thailand. In our first cohort, we have about 2,000 patients with type 1 diabetes from more than 30 hospitals across regions in Thailand. The mean glycated hemoglobin level in this cohort was about 9.3%, with significant variations among age groups. As you can see, adolescents and young adults has poorer glycemic control than other age groups. We found that good glycemic control was associated with patients aged more than 25 years, patients who were on intensive insulin treatment, and patients who were have self monitoring blood glucose 3 or more times daily. In this talk, I will address issues about emerging adults with type 1 diabetes, which focus on the age range 18 to 25 years, which are period of instabilities. People in this age group are facing many challenges, including social changes, also increasing diabetes-related distress, which may affect their diabetes management. So keep in mind that young adulthood does not immediately follow adolescence. During the early phase of emerging adulthood, between 18 to 25, the person may be transitioning geographically, financially, emotionally away from the parent home. Also, competing academic and social priorities often detract from a focused commitment to diabetes management. So many young adults with type 1 diabetes do not believe that they have achieved all of the skills necessary to remain independent and accept these responsibilities on their own. However, during the later phase of young adults, like after 25 years, they often have a maturing sense of identity and assume adult-like role in society, such as entering into a stable, intimate relationships or full-time employment. So previous studies show that emerging adults with type 1 diabetes have a high rate of poor compliance and several psychosocial problems emerging in these periods. Also, a loss to follow-up care in diabetes clinics from disruptive transition often led to acute diabetic complications, including ketoacidosis, severe hypoglycemia, and this increased risk of chronic microvascular complications in the future. Therefore, American Academy of Pediatrics, American College of Physicians, and American Academy of Family Physicians recommend that young adults with type 1 diabetes should be transferred to adult services between the age of 18 and 21 by structured transition clinics. So emerging adults and young adults need several support and ongoing education in many issues, including like college and career plans, starting on like ongoing discussion of transition to a new diabetes care team, also how to integrate diabetes into new lifestyle, supporting the transition to independence, a lot of social situations, driving, sex, sexual and reproductive issues, also alcohol and drugs have to be discussed in this particular period. Previous studies show that structured transition clinics improve patient clinic attendance and satisfaction with care, as well as improve glycemic control. The challenges of transition from pediatric to adult services are previously well described in the ADA position statement, such as psychosocial barrier to transfer, are also different in service culture between adult and pediatric providers. Also, the problem of continuity of care, like organizational issues. Also, there's a lack of well-defined criteria for determination of transition readiness. So many patients feel like keep being in the pediatric service. We found that there's some gaps in health insurance during the transition period occur very often. Another problem is deficiency in training in healthcare professionals in care delivery for emerging adults with diabetes. So in many countries, including in Thailand, there are substantial gaps in care during these transition periods. So in 2019, we established multidisciplinary diabetes transition clinic, jointly coordinated by pediatric and adult care team. So we aim to make this clinic functional in adult care settings. Structured transition programs and adult healthcare-based transition models was developed according to evidence from previous studies mentioned earlier. A multidisciplinary care team include pediatric and adult endocrinologists, nurse educators, dietitians, and social workers participated in the program development, care coordination, and provide ongoing diabetes education and behavioral support. A series of interprofessional education, training, and workshop of type 1 diabetes care in adolescents and young adults were conducted before the start of the program to strengthen a teamwork approach. We also conduct a case-based simulation training workshop in our institute. We create a simulated type 1D case scenario in the transition clinic and train the flow of team-based approach. We conduct a debrief sessions, sharing, learning, and develop together among interprofessional diabetes care team. And also we invite patients and family with type 1 diabetes also participated in our workshop. So to facilitate the transition process, a transfer clinical summary and a questionnaire on patient skill assessment adapt from endocrine society guideline. We assess the patient basic skill, also self-assessment of worries, concerns, and burdens related to diabetes. We discuss this issue in the team meeting. Once it's complete, a transition care coordinator schedule the first visit in transition clinic. At the first visit, the orientation about adult service, the system was delivered by the nurse to the patients and families. Patients were referred to diabetes educator and the dietitians for continued education to fill the gaps in knowledge and also skill set and self-efficacy. Mental health was also screened by our PHQ-9 questionnaire. This is the questionnaire to screen depressive symptoms. This was done at the first visit and every 6 months in the transition clinic. So if the patients have like a high depressive symptom scores, they will be referred to psychiatric service for further counseling and management. So the clinical care team also focused on the challenges and needs of emerging adults with type 1 diabetes, including the high-risk behavior like smoking, alcohol, sexual and reproductive issues, also barrier for management related to study or work schedules, many psychosocial challenges, and also eating disorders occur in this population as well. So after the first visit, the follow-up visit was scheduled every 2 to 4 months. Thereafter, the patient typically taken care in the transition clinic for at least 3 or 4 visits, and then transferred to adult diabetes clinic after the readiness assessment was satisfied by the team. So during the transition program, the patients were encouraged to communicate with the diabetes care team by group chat. We use the Line applications. telecoaching, education, behavioral support, and patient empowerment were conducted by multidisciplinary clinical team. We use text messages, sending pictures, education materials via this platform. Patient's problem and adjusted management plan were taking note in electronic medical record. So the relationship and partnership between pediatric and adult provider was strengthened through the group chat, online conversation, and regular team meeting. In patients who have significant psychosocial issues, we will conduct another meeting we call psychosocial conference to discuss the possible solution with the psychiatrist team and also the social workers team. So we also conduct a retrospective study to evaluate the outcome of our newly established diabetes transition programs at Chulalongkorn Memorial Hospital. So the study protocol was approved by the ethical review board at Faculty of Medicine, Chulalongkorn University. Medical record was reviewed. Data were collected from August 2019 to December 2021, while participants attended in the diabetes transition clinic. And after they complete the transition programs and transfer to adult service, we still follow up the data for at least 6 months. So the effectiveness of our program was evaluated by the assessment of the following outcomes: glycemic control determined by A1C, clinic attendance, and continuity of care after transition to adult services. Secondary outcomes include knowledge, skill, behaviors, incidence of acute serious complications like DKA or severe hypoglycemia. Also psychosocial outcomes using a PHQ-9 questionnaire were analyzed. So here the data of 21 patients with type 1 diabetes that participate in this study. 71% complete the transition program and already transferred to adult services. Median age at the transfer to our transition clinic was 24 years. Mean duration of diabetes was 14 years. And about 1/3 of patients now were studying in the university or in the occupational college. Almost 2/3 have full-time or part-time employment, and the majority of patients were under health insurance coverage. But however, we found a high rate of patients, like 40%, had to self-pay. Although Thailand had the universal coverage, like the national healthcare coverage, but many patients still experience barriers to the reimbursement issue. 20 patients in our cohort were on intensive insulin treatment. Most of them use multiple daily injections and not much that are on insulin pump. Because up to now, the cost of insulin pump still were not covered by any public sponsor insurance. So here, this is adapted checklist, assessment of patient skill questionnaire that we adapt from Endocrine Society. This was assessed in all patients. So we found that we still have a high proportion of patients that still having basic knowledge gaps and inadequate diabetes management skill set in several issues, including insulin dose calculations, carb counting, the effect of exercise on blood glucose, how to drive safely, how to drink alcohol responsibly and safely, how to monitor ketone properly, and so forth. So of 20 patients registered in this program, 15 patients complete the transition program and successfully transferred to adult service. The mean duration of follow-up is 9.2 months. The patient was lost to follow. Actually, none of the patients was lost to follow-up or experienced serious diabetes-related complication or hospitalization in the study periods. This is the A1C data were collected at baseline. This is the for the first visit of transition clinic, also during the follow-up visit until the most recent visit at adult clinics. So overall, mean A1C levels significantly decreased from 8.97% at baseline down to 8.25% at the most recent visit. And also the proportion of patients who were able to achieve targeted glycemic control in the study, we define that targeted glycemic control like A1C less than 7.5% increased from 24% to 38%. And we continue to collect the A1C data of the patient who are already transferred to adult service. And we found that the mean A1C at the follow-up visit at the adult clinic was still in a favorable trend. And this data suggests the good continuity of diabetes care. We also analyzed the PH29 score, that's the score to screen depression symptoms. 66% of patients had no symptom of depressions. However, like 7 patients have mild or moderate symptom of depressions. And those who have moderate symptoms were referred to psychiatric consultations. However, in the study, none of them has severe symptom of depressions. So this preliminary study in middle-income country like in Thailand show that a well-designed and dedicated multidisciplinary transition clinic for emerging adults with type 1 diabetes can improve clinical outcomes, clinic attendance, and enhance the patient self-management skills. Addressing psychosocial concern and mental health screening is essential in these populations. The strategy to strengthen pediatric and adult provider partnership and interprofessional education are very necessary. However, further work is needed to understand the components that may impact on diabetes care and well-being in these populations, and also have to identify innovative intervention or best approach for patients who continue to have poor glycemic control despite abundant support from multidisciplinary care team. So I would like to thank the multidisciplinary staff at the Transition Clinic of King Chulalongkorn Memorial Hospital for their excellent contribution for patients' care. We would like to thank all patients and families for being part of our family, sharing joy and pain with us, learning and grow together with us. So over the past several years, organizations, associations, along with various policymakers and the institution of public health have been working hard to drive reimbursement of the medicine, devices, benefit packages that would give many diabetics a chance to access a higher quality of care. However, there are still many patients who have problems accessing health insurance, and there's still some disparities in healthcare schemes. So young people with diabetes still experience problems with stigma and discriminations in our society. This is due to the public misconception and also a lack of knowledge and understanding of the disease. So this is we have to still have to a lot of things to working on. So currently the problem regarding diabetes accessibility in Thailand matters are being pushed by many parties, including academias, professional association such as Diabetes Association of Thailand, together with Ministry of Public Health, National Health Security Office. So with conjoint efforts, these parties have developed and created a line of network like Thai Type 1 Diabetes Registry Care and Network, we call the TICDAR CN. The program offers teaching materials and training for diabetes educations at affiliated hospitals within the network. Also, the collected data also help push forward policies to allow type 1 diabetics better access to glucose, keto strip, education, insulin, and also technology equipment. So with this policy in place, they can offer a higher quality of healthcare and safety for those living with diabetes. So we would love to work with the NGO like A4D as well. This is the collaborating activities to build a better societal understanding of type 1 diabetes is very essential, and this may help improve decrease social stigma. This is the art exhibition hosted by Diabetes Association of Thailand that we tell the story of children living with type 1 diabetes, and this is to educate the public and also raise awareness of type 1 diabetes in our society. This is the drawing of the children with type 1 diabetes. So I would like to thank the audience and the A4D for organizing this webinar, and hope this content is useful for the care team in Southeast Asia regions and also all around the world. Thank you.